it was really fascinating to me to see the range of understanding about the story I was telling. I had some of my clients within 2 or 3 sentences knew what was going on. I said, my son did this, and they're like, oh my God, he's got diabetes. And then I had others, and I get to the end, and then I'm like, and then the glucose came back at 350, and they're like, and I'm like, type 1 diabetes. And they're like, oh yeah, it is the first time in my career I have discerned a significant knowledge gap among pediatricians. I've felt it with some behavioral stuff. And maybe that's partially because I also feel it as a non-clinician. Can't see how to manage depression or whatever. That's like over there. But with the stuff that can be measured by labs and measured by your eyes, and you can actually ask a few questions, and it's a boy, I'm just gonna be really dangerous when I say it. You guys can slap me and I will accept it. It seems to me that in most circumstances when it presents, it's obvious once you get some of the element. Like there are three or four check boxes where you're like, literally we were at the hospital. My son showed up. He's, yep, I've had polyuria and polydipsia for 2 weeks. I've lost 35 pounds. We went through the whole thing and they're like, so I guess we just need to take a blood test. He's, yep. And that's, I think there are pediatricians out there who have been like, ooh, I think we're going to have to give you a whole workup. I don't know what it is. And that's the first time in my career I've felt that from some. And Dan, I don't know if you see it, George and Irma, I don't know if you see it, but I was surprised in a couple instances about that.
You could slap me too for this,
Yeah.
but being the gray-haired doctor and having been at a time when we wrote our notes on paper, we didn't have near the degree of labs that we had. And we did this thing called physical exams and took histories and so forth. We relied on those bits of data, information to help to guide us. Now we rely on the lab to guide us. And let me just give you an example. All right. Recently had a patient who was less than 2 years of age and had some significant constipation and some growth issues, some delay in their height, and they had developed some arthritis. And so the pediatrician had sent them to the rheumatologist, and the rheumatologist ended up putting the child on methotrexate and blah, 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 and then steroids. And I finally said, whoa, wait a minute, time out. Do we understand that the mom has celiac disease? And have we thought about the fact that arthritis and the presentation of poor growth, distended abdomen, constipation, and now with arthritis, the kid likely has celiac disease? But they were relying on a test that was done 10 months ago. And they said, oh,
Yep.
that test was negative at the time in what was probably, I don't know, 14-month-old. All right. So that's a story.
Like more than half that kid's life ago. Like,
yeah, more than half that kid's life. All right. In his developing immune system. And so we tend to need to put down the EHR for a minute. We need to put down the pen. We need to take a look at the patient, look at the bigger picture, and go, okay, let's think about this.
Right.
Once the child was taken off gluten, within 4 days, he was remarkably better.
Oh, and happy.
And so you are correct that we're relying on some things today and not putting enough emphasis on other things. But that comes
And
from
those
the gray
things
haired back.
aren't good enough yet. We all see it. We all see what it can be. There will be a time in our lifetimes when the EHR, some other tool, is helping you with clinical decision making. It takes your input and says, hey, you didn't stop to think about celiac. Hey, this kid now probably needs an A1C lab.
That's right.
All right. That time is coming. But a lot of people, the moment the EHR said one thing, they're like, oh, I don't have to think anymore. And we're all guilty of it. I want to be clear. I'm being critical.
All of us. Yeah.
It is. I am as guilty as anybody.
Thank you.
And who is more sympathetic as a non-pediatrician to what pediatricians have to go through than I am? All right. You guys can be empathetic to yourselves, but I'm sympathetic for what you have to go through. but it's not an excuse. You've got to use your brains. And I mean, if you don't keep using your brains, by the way, the computer's going to take your jobs. So you've got to be the
Yeah, that ain't
difference
gonna
between
happen. Life machines. Yeah, so
it's not going to happen that way, but you need to play your role. All right.